Hi and welcome back to my YouTube channel. I thought today would be a good time to explain x-rays the way I explain them to my patients. I try to keep it as simple as possible. So the first thing I tell my patients is when you're reading x-rays, you're just looking at black and white images. So like you see here, black, white, and gray. So black indicates a material that's not very dense. For example, this is air that we're looking at right here. Air, not very dense, so it appears very black. When we start looking at the tooth, the outer surface of the tooth is very, very white. That indicates that that area is very dense. As we go inside the tooth, it becomes gray. This is dentin. Then the nerve is right here, and blood and all that. That's in the middle. That's why that appears black, not very dense. So that's the background with x-rays. Something that appears white is very dense, like teeth, bone, or metal, or some other foreign object. Things that appear more black are less dense. So let's start off with the first type of x-ray that we take here at the dental office. Most dentists take bite wings, and bite wing x-rays are x-rays that we use to look at the teeth, to look at the top of the teeth, meaning the coronal portion of the tooth. And when we're looking at the coronal portion of the tooth, we're looking for cavities or defects within the tooth. So when we're looking at this image, I'm looking for anything that might appear dark or abnormal. These images appear pretty good. I don't see any cavities on these teeth. To give you the basics, this outer layer is enamel, the strongest part of the tooth. That's why it appears the whitest. That's the enamel. After that, you have the dentin. That's that area. That's a big gray. Not as dense as the enamel. And then, like I had said earlier, the nerve is right there. So these are the three main portions of the tooth. What we do see on this x-ray, even though we don't see any cavities, is I see these little white flakes. There's one right there, and then one right there as well. So those little flakes are pieces of calculus or tartar that's built up under the gums. Anyway, this is a tooth. This is an x-ray with teeth that look pretty decent. Just a little bit of buildup underneath the gums. Let me scroll down, and maybe we'll find an image with some cavities. Let's see what we have. So this image is great. We can see this dark area here where the arrow is pointing. This indicates a cavity. How do we know that? Well, we know that because this area appears dark where it shouldn't. Like I had said earlier, a dark area of a tooth is not as dense. An area that's white is more dense. So this indicates a hole in the tooth or a cavity. Now, if I looked at this x-ray, I would tell the patient that they have a relatively deep cavity. This area of decay is very close to the nerve, which is right here. So this tooth most likely needs a root canal because the decay is very close to the nerve, and this tooth is at risk of becoming sensitive. Let's scroll down a little bit more. This image is great because it shows things not natural in the mouth. So for example, each of these F's represent fillings. Silver fillings or white fillings will appear white. Metal fillings will appear more white because they're more dense. Here we see a crown, which is made out of zirconia. Again, zirconia always appears very white in the x-rays. Here, if we look at this area of the roots, we can see that they appear white. This is because this tooth had a root canal done on it. Root canal teeth have a material called gutta percha. It's a rubbery material that goes into the nerve canals. And we can contrast that with this normal tooth right here. As you can see, black, not very dense. There's nerve tissue, there's blood. Here, that area has been removed and replaced with gutta percha. Let's scroll down one more time. All right, this image, this is a type of an x-ray called a periapical. You can see periapical right there. Periapical x-rays are used to look at the roots of the teeth, not just the coronal portion right here. And when we're looking at the coronal portion, we're looking at a number of things. One of the main things we're looking for are infections. Here we can see a sort of a dark halo around the root of this tooth. That indicates bone loss and an infection around this tooth. This is a relatively large dark area around the root. It's likely that this tooth will require an extraction because there's not a lot of bone around it supporting it. If we scroll down, we found another area of bone loss. You can see this black defect right here. Where this white line is where the bone should be. This person has some localized bone loss right in this area. It's a lot of bone loss, and likely this tooth will need to be extracted. So that's it for today. We've gone over two types of x-rays. Periapicals, which are focused on the roots of the teeth, And we looked at bite wings, which are more focused on the coronal portions of the tooth. If you have questions, let me know. Leave a comment below. And again, thank you for joining me. Have a good night.